Hello, my name is Carmen Wardwell, and I live in Loma Linda, California. I am a cardiac and pulmonary rehabilitation specialist at Loma Linda University Medical Center, and my love for my field, for my department, and for my patients inspired me to seek out my professional area of focus, which was wholeness and health and healthcare models and practices. I selected to research the integration of wholeness and health in cardiac rehabilitation and its impact on patient outcomes. The primary goal in secondary or phase 2 cardiac rehabilitation is not only to address the physical component of rehabilitation through monitored exercise, but also to address the lifestyle behaviors and emotional, social, and spiritual domains of wellness that have impacted or are impacted by the patient health status. We seek to provide a whole person health model to all of our patients that participate in our cardiac and pulmonary rehabilitation program. The core message reflected in my research is that the evidence is overwhelmingly in support of comprehensive cardiac rehabilitation programs that address each domain of wellness, as well as behavior modifications apart from the exercise rehabilitation component. This will provide greater outcomes, higher levels of success, improved quality of life, and a significant decrease in risk of mortality, as well as a reduction in future hospitalizations for patients with cardiac or pulmonary conditions. Despite this knowledge, there are still many facilities nationwide and beyond that are implementing a physical rehabilitation only model, meaning they only engage in 36 sessions of monitored exercise. They neglect the critical aspect of behavior and lifestyle motivation and modification that increases the rate of success post-cardiac or pulmonary rehab. The most common barriers to implementing this type of model lies in adequate resourcing. A successful comprehensive cardiac rehab program will consist of a multidisciplinary team. This will include an exercise physiologist, a psychologist or therapist, a nurse, registered nurse, and a registered dietitian. Whether it is a result of not having the financial support to hire each one of these qualified professionals to be able to address the whole person needs, or the resources to adequately train professionals, this prevents facilities from being able to efficiently provide whole person holistic care to our cardiac patients. Leaders and governing bodies in the field of cardiac and pulmonary rehabilitation, such as the American Association for Cardiovascular and Pulmonary Rehabilitation, are taking action to champion change that would improve the quality of care and endorse whole person care initiatives and setting them as the standard of care nationwide. There's still so much work to be done, however. My key takeaway is that healthcare professionals need to work together collaboratively to advocate for these critical services and provide initiatives supporting the initiatives within your organizations or communities. If you have a cardiac rehab center in your community or in the organization that you work for, we need to lobby together with our lawmakers and our stakeholders to pass policies that are centered on value-based and whole person care. In this manner, we will be able to address the whole person holistic model, advocating for a complete program that addresses the psychological, the social, the spiritual components, as well as others that impact patients and impact their health. Thank you so much.